This is actually for everybody, because if you can regulate your blood sugar better, you get more out of life, right? It directly affects your energy systems. Energy is the currency of life. It affects digestion. It affects neurotransmitters. It's really for everybody for optimal function, right? Welcome to the True Health Solutions podcast. I'm your host, Dr. Lonnie Bagwell, stress, inflammation, and functional health clinician.
And I'm your co-host, Brigitte Spurgeon, metabolism and nutrition expert.
This podcast is where we bring hope, truth, and inspiration for your holistic health journey.
Because the world needs the best version of you.
Hello and welcome to True Health Solutions podcast. I'm your host, Dr. Lonnie Bagwell, here with
Brigitte Spurgeon.
And we are going to be following up with our last episode. This is part 2, talking about blood sugar, diabetes, not just diabetes, but dysglycemia, which is really, we talked about this last time, but this isn't just about someone who has a family history of diabetes or who has really bad A1Cs or whatever. This is actually for everybody, because if you can regulate your blood sugar better, you get more out of life, right? It directly affects your energy systems. Energy is the currency of life. It affects digestion. It affects neurotransmitters. It's really for everybody for optimal function, right?
Absolutely. And this is not just if you fall into the stereotypical category of being obese or having certain medical conditions. We see a lot that when someone is tall and thin, or even in young people, that they definitely can have dysglycemia, or, we've said on our previous episode that hypoglycemia is dysglycemia.
There you go. Perfect. And we're going to give some specific examples or case studies as we're talking about. This episode's all about the solutions for how do we better regulate our blood sugar. How do we, come out of dysglycemia one way or the other? And I just want to be an encourager from the beginning. There's a couple of things I want to share here as far as from a journal and then from a specific study that was completed with the Marshall Islands. But for anybody who's listening to this and they say, man, like I want to regulate my blood sugar better for either disease prevention, disease reversal, or optimal function, be encouraged that this is not something that takes months and years. While we have a lot of different conditions that walk through the doors of this office, and certainly I just had to have a conversation with someone, significant neurological issues, we're have a multi-month reevaluation expecting up to a year of recovery. That's just the reality of it. This is not one of those things. This is, you actually are going to share something here in a second that was pretty awesome. But I just remember my dad, and he was visiting one time, and we had my parents never stayed for more than maybe 5 days at a time. And somewhere in those first few days, I remember my mom was like helping him out, getting his blood sugar tested because he needed to take his insulin. And, and so he was always testing it to make sure it was okay to take it. And I remember them sitting there with a test kit and with his insulin. And then they were totally perplexed because they didn't know what to do because he was so used to taking his insulin. But after eating the food that we had fed him when he was here, clean foods, and he was running around with his grandkids, my sons, right? And then he had activity, he had clean foods, and all of a sudden his blood sugar was totally normal, and they didn't know what to do, and they were totally perplexed. They were like ready to call the medical doctor because they're like, what do I do? And I said, Dad, you don't need it. Like, you don't need that. Like, it's telling you you're normal. Like, embrace that. Right? And enjoy the fact that you don't have to put more medication inside your body, right? And that was just in a few days. And then you have studies that come out, and this isn't just like my experience. It isn't because there's some kind of, superfoods that we fed them, or some kind of crazy supplements. Like, this really was just a behavioral change for a couple of days. And then if you go to the Journal of Diabetology, it tells you type 2 diabetes can be reversed through diet changes. And in this particular study, it happened anywhere from 1 to 8 weeks, even in the most severe cases. And it says here, the quote from Dr. Roy Taylor, medical doctor, it says, the bottom line, a dramatic diet change in diabetics reversed most features of diabetes within 1 week. And it reversed all features of diabetes, all of them, within 8 weeks. And I remember my dad's legs really changing color, just really quickly, as he would make some changes. So share with us a little bit more of your experience, as far as seeing some pretty cool results with some behavioral change.
I certainly have seen amazing results with type 2 diabetes. And we have had their medical doctors say things like, because of the changes you've made and because of what we're seeing in your blood glucose or with your A1C, you have reversed your health condition, which that's amazing just to see that done with diet and lifestyle changes. And, certainly being an obesity specialist, I work with a lot of type 1 diabetics as well. And, diabetics who have been diabetic their whole lives, that they were diagnosed with juvenile diabetes. And so I have in many adult onset insulin dependent diabetics, I have seen them come off of their insulin in as early as 24 hours.
Yeah,
so
I've had
patients report and this is nothing, by the way, this is not based on my recommendations, that, that's out of my scope. But that's based on what they know about checking their blood glucose or what their doctor or their PA has told them. And so I'm learning this after the fact. They're like, oh no, I haven't, because I'll ask them how many units of it, if they come in 60 units of insulin, I'm going to be checking up on how much insulin they're taking, because the goal is certainly to minimize the insulin load, because that directly is going to affect fat loss. So I'm always checking up on that. And they're like, oh no, I haven't taken insulin since, day 2, on the program. And then I have seen, now most of the time I'm seeing patients not need insulin anymore, or certainly come off of their diabetes medication, due to their numbers. But I have seen adults who have had diabetes since they were like 8 or 9 years old. I've seen them being able to take their insulin down to a very nominal load.
Mm-hmm. Yeah, no, that's awesome. And so, and just to continue to be an encourager here, because when we're talking about dysglycemia, we are talking about some behavioral changes, nutritional changes. That's the thing that, people a lot of times, already have it in their head, like, oh, if I could do this. It's so important, as always. We're talking about solutions for this today, and we always start with mindset. So you can come back, you can be reminded, you can hear the stories of type 1 and type 2 in a day or a week and all that. But there's actually whole countries or whole people groups that have experienced this as well. And so when it came to this, the Marshall Islands is the one that I shared in the most recent workshop that we did. And it was, so here we have the Marshall Islands. 60 years ago, they were physically active, they lived off the land, and there was virtually zero diabetes, like no dysglycemia to be seen in the Marshall Islands. But then as 80 to 90% of their food ended up being imported as their population grew and exposure and accessibility happened, they ended up going from no incidence of diabetes to one of the highest diabetes rates in the world. Okay. And so just right there alone, if you're looking for more motivation and inspiration to move away from our stuff, when we take our stuff here, the standard American diet and all the extra toxicity that goes with it, and we import that into a new people group, they literally develop all the same diseases that we've created in the last 100 years. And a lot of people kind of think like diabetes, oh yeah, been around for thousands of years. No, it hasn't. Like, this is something that we've created. Okay. And then so that this missions group goes in, Canvasback Missions, in partnership with the health ministry of the Marshall Islands, goes in, and they say, we got to change this stuff, right? And so they got rid of the Western foods. They started to increase the cultivation of foods, back on the islands. And in the first 2 weeks, people's fasting blood sugars decreased from 50 to 100 points. Their triglycerides fell at the same time. They started to lose 1 to 3 pounds a week automatically just by changing the cleanliness of the foods and regulating their blood sugar. And all of their pain started to go away was the other thing that they actually felt like was a significant finding of the study. And so all that inflammation just started to drain. Their liver started to work better. Their gut started to work better. So anyway, so be encouraged that this is something worth fighting for. And I was just sharing with Brigitte, I know a friend of mine that started a radio show on dysglycemia and diabetes, and his practice blew up because it's something that people see results so quickly in, right? So he started talking the truth, like we're sharing right here on this podcast. People started doing the things that they recommended and obviously being evaluated in the clinic. And then next thing you know, like the results were so fast that it was just like a wave of people started to realize like, hey, we can actually, get out of pain really quickly. Just by paying attention to what we're eating. And so anyway, so be encouraged as you're listening here, and just know that there is a solution no matter where you are on the spectrum. And often this is a solution for a lot of different symptoms that we see, right? So this is a big topic. And there was something that was common across all those stories there. There's one thing that everybody, that has to be a component of recovery, which is, like we always say, you have to know your numbers, right? More testing, less guessing. And so we want to talk a little bit about that right now. So there are, and I'm going to frame it by talking about continuous, which isn't accessible for everybody. I get that, but understand that there are people right now that you've seen. I talked about this in the last episode, where they're walking around. They don't have diabetes, but they're wearing continuous blood glucose monitors because they want optimal performance. But what they're able to tell from constantly checking their blood sugar, they can see things like, what did that meal do to me? What did that stress do to me? That my work day, what does that do to my blood sugar? And how is that affecting my energy, my sleep, my digestion, my hormones? And so while that might not be accessible to most people, there is incredible value in testing with what you do have access to. And so share with us, Brigitte, a little bit about what you've seen recently, kind of in your own life here, as you've begun to test.
Yeah, so I've worked with patients in several different categories. And so we've been able to accumulate clinical data, not just on patients going through our weight loss programs, but we've been able to, gather data from athletes, from those who are underweight or thin, from those who are, over the age of 60 or 70, plant-based diets, keto diets. In fact, we even have a case study for someone who did a 14-day water fast. So we were able to track their ketones and their blood glucose numbers, seeing how they respond to exercise and sleep and things like that. So we have gathered a lot of data, and it's just really interesting to see how different people respond. And this is why we always talk about everyone's body is unique and responds uniquely. And so we can't put any solutions in a box. Now, this is really why you need a clinician. This is why testing is so important. So when I'm working with someone to reverse disease or even just for nutritional support, I love being able to test. And this is one of my favorites. So, simply put, I think everyone has access to a drugstore like a CVS or a Walgreens or a Walmart, and you can purchase a simple blood glucose monitor or a glucometer. And so that is going to be, you're going to get it in 3 parts. There's a little machine. You should have a little pen that comes with that. So that's where you're putting the lancet in to prick your finger. You will purchase strips with that. So you have your lancet, you have your strips, you've got your pen for the lancet. It's so simple. Like, it's just like this. You don't even feel it. It's like this quick pinprick. And then you have the actual meter where you're putting the strip in, and that's going to read your blood. I always, just a little tip here, and I've done this, Dr. Bagwell and myself have done this over the years. I probably have been intermittently, even though my numbers are healthy, I don't have any symptomatology that would require that I test my blood glucose. I like to understand how my body functions, and I like to hack my body. I like to do biohacking and things like that. So I love doing this. I've been doing this for a while now. But if you're checking regularly, I recommend, let's just say you're using these 3 fingers, and then you're, pricking one side and then the other side, and then the other finger, then the other side. So otherwise, so you don't get bruising or you don't get sensitivity on your fingers. So, so just simple solution. I think you would probably spend up front, I don't know, maybe $50 to $70 on all of your supplies to get started.
Yeah, that's good. And I actually ended up doing, I went with Keto Mojo so that I could look at when I really started to get into it, it has the blood sugar testing, but it also has testing for ketones. So I can see what is it taking when I change my nutrition? What does it take for me to get into more of a ketogenic state or into fat burning and stuff like that too? So you can spend a little bit more money and get the ketone strips and all that as well. Not necessary. I mean, honestly, you can derive most of the data just from looking at the sugar levels to know, and then looking at symptoms and such. But again, if you're working with a clinician, we can walk you through it with all your basic, numbers. And obviously we look at things like when we're doing actual blood work, we'll get glucose levels, fasting, we'll get fasting insulin levels so we can understand more of insulin sensitivity. There's additional markers that we can include in some of that lab work to really start to determine, other sensitivities like higher levels of insulin sensitivity, the fat burning sensitivity, like, is there anything that's gunking that up? And of course, we're looking at A1C all the time, for patients at that point, high sensitivity A1C actually, as well as other factors. So anyway, so there's advanced testing that you can do, which we always recommend that kind of testing, at least having as a baseline. Everybody should have those tests, but then on a daily basis and even throughout the day at different times you can test. I think that's one of the really cool parts for me. I remember doing the testing here in the office where I'm sitting now, actually more in where your office was over there on the other side. And I remember running in there, like having a really stressful day. And I was testing when I was supposed to be testing, but it was after stress. And I was learning, I was like, man, the stress really hit me hard. Like my blood sugar is still not coming down, and then wanting to do it again like an hour later, and then like again an hour later, because I want to try to track and see how my body was responding. So, anyway, so we love testing, and we love blood sugar as a way to, just one of the cornerstone biomarkers to be able to understand for human performance, for fighting inflammation, for fighting the stress response, and just helping people, live healthy. So definitely more testing, less guessing. And I think I want to hit on something that you did say here for clarity for listeners, is that we have had skinny people, obese people. We've had people that fast and have, and their blood sugar looks amazing. We've had people that fast and their blood sugar does not look good. We've had people that that exercise intensely and their blood sugar does exactly what it's supposed to do predictably. And then we have people who exercise intensely and their blood sugar does not respond appropriately. And so the point there is that's why we want the testing, because everything you can read a book, you can Google online nowadays, more Googling than reading books, but you get the idea, and it can tell you what's supposed to be happening. But we tend to work with people who have some kind of clinical manifestation of dysregulation. And so therefore, it's usually not happening the way that it's supposed to. So the testing helps us understand and pinpoint, okay, this is an insulin issue. This is look at your history. Okay, this is toxicity related. This is whatever, right? Metabolically related.
Let me give two examples of that. So, for example, I can fast for a day and I can check my blood sugar and it's just average. So my sugar just at fasting or in between meals will sit in the 80s, somewhere in the 80s. And I think we mentioned on our previous podcast, if you haven't listened to that, by the way, definitely go and get that as an introduction.
Yeah, it'll make more sense out of this podcast.
Yep. But I like my goal is to see between 80 and 88 for my numbers, certainly for a fasting number. And so what's so interesting is like I will just drink water for a whole day and I can still test an 85 or an 82. I have seen in someone who is diabetic, and this is not even fasting, but this is following low blood sugar nutrition, or low sugar nutrition, and it can actually, because they're so dysregulated, it can tank their blood sugar numbers, and now they go hypoglycemic, and they can end up at a 68, or I've seen with fasting the numbers even go a little bit lower, and depending on what they're used to. So if you have a diabetic that's used to an average blood sugar of 110, you take it down to an 80 with nutrition, and they're like feeling weak, like they literally can pass out and end up in the hospital. And I have seen a case like that. So it's really interesting. Then in the example with exercise, so I've seen someone with a standard American diet, and they check their blood sugar. So let's say 30 minutes to an hour post meal, it's at its spike. So, let's say it's at a 200, and then they go and do 10 to 15 minutes of exercise. And that exercise alone, and they test right after, can bring their blood sugar down, I don't know, like 50 plus points, can actually get it down to a normal level, like get it down to like a 95 or something like that. And that's so powerful to understand. It's not like you need to be in the gym an hour every day. Literally just going for a 15-minute walk post meal is so powerful for your blood sugar. But then I've also seen on the other side where someone is in a either a low carb nutrition or in a fasted state, and they exercise and it raises their blood sugar.
Yep. It's crazy. And that's, again, we got to test, and we need to, and you start to get the pieces of the puzzle, and you need someone that can actually, just to kind of harp on this a little bit, is that you start getting 2 or 3 puzzle pieces, and it can really start to get clear for the person who knows how to look at that properly. And I don't want to, and there are a lot of great medical doctors out there that do these types of things, but then are a lot that just say, oh, it's within normal limits, so we don't have to worry about it. And that's just not true, because normal limits for them are, you're not in a full-blown disease state one way or the other, or emergent, right? Or at least maybe urgent. Whereas we're looking at functional ranges. We're looking at ranges for your body to do what you want it to do, not just not be building disease. And those are 2 very, very different things. And so right set of eyes with the right thinking can really take the same information and translate it into ridiculously better quality of life and better health and all that stuff, right? Disease prevention. And so definitely, so number one, most important thing, mindset. Understand that this stuff can be done and is done all the time for people. Number 2, make sure that you're testing, not guessing, and that you're working with someone to understand what those ranges look like and apply it to your health and your life, because it can be totally different for everybody. And then let's talk about just kind of for the rest of the show here, let's talk about some of the, most common things that we would do with patients. Of course, we believe in testing, so we got to customize the recommendations. But talk nutritionally about the basics that are pretty much going to be applied to most people when it comes to correcting dysglycemia or any blood sugar imbalances.
So a top nutritional recommendation is going to be to include, and once again, this is if you need to lose weight or not. This is also for
across
someone
who,
across the board, to include protein in every meal. Mm-hmm. It is, if someone's having a bagel for breakfast or cereal for breakfast, they're going to have a spike. Or if you're the person that at night has a late night snack, like you're having some ice cream or some crackers or chips or a glass of wine, that's just carbohydrates. Sugar. Carbohydrate spike. That's just sugar. And by the way, even a no sugar, so like bread or potato or something, or pizza that you think doesn't have sugar, by the way, that still causes a major spike. Mm-hmm. Processed foods, any refined carbohydrates causes major spike in dysregulation. So my recommendation is to include normally an animal-based, like fish or meat or eggs, with a meal. I think sometimes I find people think that lentils or nuts are protein. And so certainly they have some protein in them, but we're not counting that as a protein. I'm talking about meat, fish, eggs, or something, I know, like a bone broth protein powder or something like that. That would also count. So protein is going to be the number one focus for that. And when you're eating it, let's say you're eating a meal that has your protein, your complex carbohydrate, your vegetables, healthy fat, start with the protein. Do the protein first. Don't do the carbohydrate first.
Good. That's good. And just clarity there for everybody listening. Like that means, like, we're not encouraging you to eat bagels, but what we're saying is that you might be consuming the same number of total carbohydrates and have the same glycemic impact on your body, but how your body responds with or without protein is radically different, right? And so even if you're going to consume that, this is a great holiday tip. I'm just thinking, like, we're recording this, coming up on Christmas season, which is like, so we're in sugar season. And so it's just, if people would eat more protein in the month of December, then we'd have way less diabetic incidences and, way less people getting on medications and ending up with doctor's appointments in January, right? So good timing on that, but go ahead.
Well, the thing is, when you eat only carbohydrate, you are going to be hungrier within a shorter amount of time. And that, by the way, biochemically does have to do with the blood sugar spike. And so, because the sharper your blood sugar spike, the quicker it comes down, which, by the way, is a stress event. Do you know that when you eat only carbs, that is stressful on your body, and that actually will affect your cortisol. So that is, eating carbohydrates is considered a stressful food for your body. But the other thing, just logically, if you're filling up on protein first, you have less space, less room for the carbohydrate or for the processed foods, or less
Right.
need for it, and you're going to have better satiety.
Right. Sometimes it's just mechanical, right? And I think I want to say this now, and we didn't talk about this beforehand, but it just hit me here that I've been seeing so much of this. I don't remember seeing low sugar or no sugar or artificial sweetened things advertised like this year. For whatever reason, it's just like kind of out of sight, out of mind. But in the last month, like leading up to Thanksgiving, I can't believe how like I was picking things up. This is essential oil, not related, but I was picking things up and I couldn't believe how much artificial sweeteners were in things. Like just that I was getting for Thanksgiving last week, or that I was getting for just general grocery shopping or whatever, because it was the holiday season coming out. So like they're just playing off of everybody's concern for overconsumption of sugar, and because that perception is that non-sugar or no sugar added that adds all the artificial sweeteners is healthier. But I just want to be clear for everybody on here, because that becomes a common conversation with diabetes and all that, right? Is that the artificial sweeteners actually promote overeating and promote weight gain. So number one, number two, right there, boom, out of the gate. They elevate fasting glucose levels. So a lot of people, there was a misconception for probably 30 years that if I eat artificial sweeteners, then my blood sugar just stays the same. And that is just absolutely not true. Okay. In fact, I've seen several studies where people who were eating artificial stuff had worse HbA1c than those that were actually still consuming sugar, because the body can actually do something still with the sugar, whereas the artificial sweeteners, not only are they harder to perceive and react to by the body because they're artificial, but they actually are to a degree toxic, depending on which ones you're consuming, which actually mess up your insulin receptors, right? So your body will respond to, right? So there's that. Then by doing that, it decreases your insulin sensitivity over time, which, if you go back to our last episode, is really what we're one of our biggest concerns here. And it will actually cause you to put more fat on your organs, which is the fat that we care the most about, because that's the stuff that will actually choke out your organs and ultimately decrease overall function and create disease. So artificial sweeteners are absolutely a no-go. And I'm going to say something that's the unpopular opinion, but we just have to understand it, is that even some of what we would consider to be the good alternatives to sugar, maybe stevia even, a lot of people actually have blood sugar spikes and get completely dysregulated even when they're consuming the, quote, healthier artificial sweeteners. So I thought that was important to say on this topic, and especially at the time that this is going to come out, during the holiday season.
That has even made it into the literature now. Actually, the research has been done on that. I was really proud of myself traveling outside of the U.S. for 8 months. Zero like stevia or monk fruits, which would be the ones that I would allow into my diet, but I try not to do them much. So when I was in the States recently for a couple of weeks, when I was in the clinic, I did treat myself. I had some Zevias.
Yes, I saw that. Yep. I drank the last one that you left in the fridge, actually. So thank you for that.
So the other thing the other nutrition strategy that is really powerful is food timing. I know I talk about this a lot, but it has been researched specific to insulin sensitivity, is not to eat when it's dark. And so not eating like too early in the morning before it gets light, or not eating. So this really affects your nighttime meal, but because basically your insulin is not as sensitive at nighttime. So just for example, you will see in the day, if you have, let's say, a continuous blood glucose monitor, you'll have the insulin spike postprandial, which means post-meal, and then you'll see it come down. And by the time you normally have your next meal, it will be like down to a normal, 85, 90. But overnight, it takes longer to do that. So that's because your insulin is less sensitive. So that takes, normally say like overnight, it's like 12 hours before like your insulin gets back to that low healthy or fat burning level. So just thinking about your meal timing, so not eating late at night, not eating before you go to bed. I think it's also good to notice, I sometimes work with patients who I think it's just not talked about. So like you just don't know that this is happening. But a lot of people wake up at like 3, 4 in the morning and they can't get back to sleep until they eat carbohydrate. And so, and it's just more common than people realize. I think a lot of people who do it, they just think that they're weird, that's an anomaly and something, something's weird
Yeah.
about them. But that's dysglycemia.
That's a definite red flag for dysglycemia. Yeah.
Yep.
And to remind everybody, when we're saying dysglycemia, like either way, however you're dysglycemic, however your blood sugar is high or low or whatever, you're in a disease state. So again, this is not just about weight loss. This is not just about, I want a little bit more energy through the day, although those are good things, or I want to sleep better. This is like literally you're building disease or you're not building disease.
Yeah.
Yeah, that's good.
So I had a patient I was working with that, and he was doing carbohydrate, like crackers or something, and then he was trying to be healthy. So I switched to an apple, but it was still better, but it was still carbohydrate. And then I think what we did with him is we switched to like a boiled egg, so that he could still doing something, but he could get back to sleep. But actually, when he started working on his nutrition program, he said he didn't need anything, and he stopped waking up and didn't need it anymore.
Yeah,
so
that's awesome.
It sorted itself out.
There you go. The behavioral change quickly too. Probably it didn't probably take 8 months for that change to happen, right? Like we talked about before, it can happen in one day to a week to 8 weeks. Couple other quick tips because we're in sugar season, but we're also in alcohol and tobacco season. Probably tobacco more because people smoke more, chew more, whatever under stress, and this is a stress season. But also more alcohol going to be consumed between now and January 2nd than any other month of the year. And so, and these are things that specifically cause nerve damage, kidney disease, blood pressure spikes, heart disease, increased cholesterol because of their spike in inflammation. Excuse me. Doubling the risk of pain during this time of the year. But of course, I'm saying it right now because these are also things that significantly can throw off your blood sugar levels. And this is the time of the year where, again, we're talking about, we've already gone through several things, and we can go through a list of 20 other things that mess with your blood sugar. But it's this time of the year, because it's being recorded at the end of November, beginning of December, where people are going to consume more of that than the other time of the year. And then one other thing that I'll end with, and Brigitte, you can add, anything after I'm done here. But and this is really its own episode. In fact, we've done episodes surrounding stress. But understand cortisol has patterns, and that when you wake up, you have a certain level. As your day goes on, you want increase in cortisol so that you can perform at life. I have so many patients that come in and they're just so lethargic and can't get going, and it's just really a total emotional letdown when they can't get up for their kids in the morning, and they can't perform at work during the day, and it really becomes this anxiety depression cycle that happens. And then the cortisol is supposed to come down as the day goes on and kind of level off, and so you can rest properly at night. Well, just understand, if you're dysregulated, then you are fighting that. I mean, it's like your day is like the old funny story of like, I walked uphill both ways to school. Like, people are really living that if you're dysglycemic when it comes to being able to perform at life every single day. It's like when your cortisol is supposed to be up or it's supposed to be down, either way it's a struggle. And either way, it's a battle. It's a battle to get enough cortisol to do life, and it's a battle to bring it down in order to be able to rest and recover properly. And I think knowing that stress being the underlying cause of 21st century disease, and dysglycemia being so intimately connected to it and so impactful in the cortisol levels, I think we're really talking about fighting 21st century disease when we're talking about blood sugar.
Absolutely. I agree. The final thing I will say, just to add on to that, is the effect that coffee or caffeine has. Now, there are research studies that show the benefits of coffee for reversing diabetes or managing diabetes. But I will also say, and I've tested this with patients and with myself, that that caffeine in the morning can cause an uptick in your blood glucose. So my recommendation is to shorten your window when you have caffeine and not let that be first thing in the morning, because you don't want to just like wake up at like your cortisol is already like starting to raise. You don't want to stimulate it. So my recommendation is always to drink water first thing in the morning. Don't let coffee be the first thing that you do in the morning. Sip on water, or do a big fan of doing apple cider vinegar, lemon juice in warm or hot water in the morning. Like, let your body ease into the day versus just like stimulate it all at once. And maybe let that be your mid-morning treat, is to have that coffee, or opt for some decaffeinated coffee Once again, not to say you can't have 1 or 2 cups of coffee in the day, but we just have to be wise with our physiology.
Yeah, and I'm actually a good testimony of that too. Coming off of caffeine for 18 straight months, I've been adding it back in, but I got to the point where even with decaf, so this is the rest of my decaf from the morning. Then I've gotten it up to almost 32 ounces in the morning, with or before having coffee, because this still has some caffeine in it, right? And so, my blood sugar got as good as it's ever been. And that absolutely has, I know it has to do with that for me, because if stress levels are at a certain level and then you're adding caffeine to it, now you're pushing the cortisol and you're, good luck regulating your blood sugar. And that's speaking to, and for you, it might be a little bit different, but that's speaking to a lot of people that walk through the door as patients, right? Because they're already dealing with some issues. They're already stressed over their health issues, in addition to the stress of life that likely contributed to the health issues. Now you throw caffeine in the mix, it becomes a lot tough. And that was my story. And it became a lot tougher to be able to regulate my blood sugar and get it to where I wanted to be and get into fat burning, right? So if you want to lose fat, right, and all that stuff. So yeah, that's a good one. I'm glad you mentioned caffeine. All right. Well, that'll summarize today. Oh, we could keep going on this. I am sure that if you go back and listen to past podcasts, you're going to find where we're talking about blood sugar, and a lot of the tips that we share across all the different spectrum of conditions that we've recorded on are going to help with blood sugar. So if you have any questions, as always, make sure that you reach out. If you're listening to this and you're saying, man, like, this is me, I need help with this, I want to share your lab, if you want to share your labs with us, you're welcome to reach out and do that. Schedule an appointment with any of the links below. And if you have any other questions about like different products and blood testing and all that stuff, we're happy to help you and point you in the right direction. So thank you guys for listening and being faithful listeners and subscribers. And we will check back in with you on our next episode. Thanks for joining us today on True Health Solutions Podcast. Make sure that you click to subscribe. Also, go to our website, www.truehealthcharlotte.com, where you can download any resources related to today's show or any future shows. And lastly, if you search for True Health Center Group on Facebook, you'll be able to join our free health community. We look forward to seeing you there.